Theatre time is some of the most valuable and most expensive resource in any hospital, and every minute counts. MasterCare PAS Theatre Management is designed to help your teams make the most of it, from the first booking right through to a safe discharge from recovery. Let us show you how. This is the theatre list, the single view that sets up your day. Every case is grouped by theatre, so in one glance your coordinators can see what is running across Theatre 1 through to Theatre 4, who is operating and how long each case is booked for, without chasing paper lists or ringing around. Filter to a theatre, move through the day, and reorder the list with a simple drag when priorities shift. And it is all live. The pre-op and recovery timers are already ticking, so what you see is what is happening on the floor right now. Flags such as requires admission or late start surface, the cases that need attention before they become a problem. When you are ready, one tap on Start Pre-op begins the journey. Pre-op is where delays and cancellations usually start, so this screen is built to keep every case moving. The patient banner keeps the procedure, the surgeon and anaesthetist and the key identifiers in front of your team at all times. And pre-operative timing starts automatically, so there is no clipboard and no guesswork. The nursing and anaesthetic checklists do the heavy lifting. Consent, allergies, fasting and readiness on one side, and a full anaesthetic checklist covering consent, assessment, medical investigations, pre-op and safety on the other, each with a progress bar so anyone can see at a glance what is left to do. Record the anaesthetic type, the ASA classification, and the agents on the right. Only when the case is genuinely ready does Centre Theatre light up, which helps head off last-minute surprises and gives every list a smoother start. This is where EPAS really earns its keep. The stage rail across the top captures the whole procedure in real time, 7 time stages from in and time out, through positioning, anaesthetic and procedure, to out and session close, each started with a tap and each timed automatically. That gives you accurate, defensible theatre timing for utilisation reporting, billing and continuous improvement, captured as a byproduct of the work rather than written up afterwards. And it all lives on one screen: specimens, wound status, the surgical count and the full theatre staff list, with mandatory roles locked in for safety. Coding is built right in. Add a service and EPAS suggests the likely procedure and items with a confidence score, so an orchidopexy brings up the code and the usual packs and sutures ready to accept, helping you tighten up coding and cut the time spent on paperwork after the patient has left. When you are done, Send to Recovery moves them straight through. Observations can be captured at any point in pre-op or theatre. Blood pressure, heart rate, respiratory rate, oxygen saturation, temperature and pain go in through a quick entry strip with an on-screen keypad for touch devices at the bedside. View them as trend charts or a timeline and zoom to the window you care about. Best of all, observations carry across every phase, so the recovery team inherits the full picture instead of starting from scratch. Recovery closes the loop. The list on the left separates in recovery, discharged and returned, with instant search by name or MRN, so a busy recovery unit stays organised even at its peak. Open a patient and the time in recovery counts live. Recovery is milestone driven and safety first. Start recovery, record level 1 consciousness and level 2 orientation, and only then does discharge unlock, so patients move on when they are genuinely ready. Choose the destination, whether that is the ward, ICU, home or a transfer. And if a patient needs to return to theatre, it is one tap and it is automatically flagged as an unplanned return, giving your quality team the clean audit trail they need. So what does this give you? One connected flow from the theatre list through pre-op, surgery and recovery, with timing, checklists, coding and observations captured as you go, rather than rekeyed later. live visibility of every theatre in real time, and a platform you can tailor to your teams with themes, light and dark, and high contrast and colour safe palettes for accessibility. That is Theatre Management in MasterCare PAS, designed to help you get more from your theatres, support your revenue capture, and keep patients safe, all in one place. Talk to your global health account manager to see it running with your own lists. Thanks for watching. MasterCare, Australian owned and operated.